What would you do if a family member or work colleague collapsed because their heart stopped beating? Are you ready to save a life? When someone becomes unresponsive, is not breathing, or is gasping, they may be in cardiac arrest. Cardiac arrest is caused by an electrical problem. The heart stops beating properly, hence the name. The heart's pumping function is arrested or stopped. Every year, more than 350,000 out-of-hospital cardiac arrests occur in the United States, and about 70% happen in the home. That means if you are called on to perform CPR and help a person experiencing cardiac arrest, you'll most likely be trying to save the life of someone you love. A child, a spouse, a parent, or a friend. There are two types of CPR: conventional CPR and hands-only CPR. Hands-only CPR has been shown to be as effective in the first few minutes as conventional CPR for cardiac arrest in the home, at work, or in public. Hands-only CPR has just two easy steps performed in this order. First, call 911 if you see a person suddenly collapse. Second, push hard and fast in the center of the chest to the beat of a familiar song that is 100 to 120 beats per minute. Clearly that wasn't the best song. But Walk the Line by Johnny Cash, Staying Alive by the Bee Gees, Crazy in Love by Beyonce, and Hips Don't Lie by Shakira all have 100 to 120 beats per minute. If performed immediately, CPR can double or triple a victim's chance of survival. Bottom line, the more of us who know hands-only CPR, the more lives will be saved. It's not just at home. We want you to be prepared. What if your colleague collapses while at work? Do you know what to do? Some of us on job sites are CPR trained, but not all of us. Even if you aren't CPR certified, you can step into action. Use the hands-only CPR steps we just talked about and get someone nearby to get the closest AED. Speaking of, you may not be familiar with an AED. An AED is a lightweight, portable device that delivers an electric shock through the chest to the heart. The shock can potentially stop an irregular heartbeat, also known as arrhythmia, and allow a normal rhythm to resume. AEDs are incredibly easy to use. Most have audible prompts that literally guide the user through the process step by step. So even if you've never used an AED, it walks you through the process.
Call for help now. Remove all clothing from patient's chest. Pull red handle to open bag. Look at pictures on pads. Peel one pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Peel other pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly.
CPR plus the use of an AED is the most effective way to help someone in cardiac arrest. It's not only important to know some form of CPR, but also know where AEDs are located and what your local protocols are. This is going to be different for every company and every job site, so it's important to coordinate with your safety director or site manager to learn your specific site policies, such as where AEDs are placed or who calls 911. Here are some common places for AEDs on a building site: in the project trailer, in the lunchroom or common area, or even sometimes in the lift or elevator. You never know when you may be called on to save a life. So learn hands-only CPR, know where your AEDs are located on job sites, and understand your company and job site procedures. Be ready, be prepared. You may be the one to save a life.